talk about ST segment elevation on the electrocardiogram. On an EKG, the ST segment is the period of time between the end of the QRS complex and the beginning of the T wave. This ST segment should be a flat line, as all segments should be. The ST segment is normally at the same level as the isoelectric line. So the ST segment should be isoelectric, meaning that during this period of time, there's electrical silence. During this phase, calcium and potassium are transitioning across the membrane of the cardiomyocyte pretty much at the same voltage, which causes that isoelectric line. However, in the event of a myocardial infarction, you may get something called ST segment elevation because of the leakiness of the damaged cells. ST segment elevation in particular leads that look at the same area could indicate a myocardial infarction or acute coronary syndrome. So if you had ST segment elevation in the inferior leads, this could be indicative of what we call an inferior wall MI. You could have this in the anterior leads with an anterior wall MI, the lateral leads with a lateral wall MI, and so on and so forth. ST segment elevation can be caused by many things. In fact, ACS or AMI is not the most common cause of ST segment elevation. You could have early repolarization, acute pericarditis, an electrolyte derangement, ventricular hypertrophy, an intraventricular conduction delay like a bundle branch block, or any other cause of ST segment elevation. And the absence of ST segment elevation does not mean somebody isn't having a myocardial infarction. About 60 to 70% of all myocardial infarctions present without ST segment elevation. It also depends on what phase of the MI somebody is in when you do that 12-lead EKG. They could be in a hyperacute phase, which might just present with something like hyperacute T waves without any ST segment elevation. So, the ST segment is the period of time between the QRS complex and the T wave. Elevation may indicate a myocardial infarction. We call that a STEMI. Somebody could still be experiencing what we call an NSTEMI or an MI without the presence of ST segment elevation. And somebody could have ST segment elevation without the presence of acute coronary syndrome or a myocardial infarction. That's all.